Skin disorders will try to do this as quick as I can. The only most important thing, uh, by my opinion. So you use different things: topical emollients, topical steroids, salicylic acids, benzoyl peroxide, topical retinoids, biological, oral retinols, phototherapy, and many, many more. Coal tar, um, antibiotics, different things. So the eczema or atopic dermatitis is part of allergic triad. So allergic triad is allergic rhinitis, asthma, and atopic dermatitis. So allergic rhinitis, asthma, and atopic dermatitis. That is allergic triad. Use. So emollients, the goal is to taper to emollients any treatment. That's how you start. You have to keep moist and clean your skin. Eczema is signs and symptoms is pruritus, erythema, scaly skin, and lesions, usually in flexural uh, surfaces, which is inside like elbow, whatever you bending. So emollients, you have ointments, you have creams, and you have some lipids. So the most important to know, you wash, pat dry, and apply emollients. Biologics. It is prescribed by dermatologist. It starts, what is this? It's a dupilumab, whatever lumab finishing with. Next is topical corticosteroids. The more potent is corticosteroid, the more side effects you will have. First line for flare-ups, that's the topical corticosteroids. So with sensitive areas, you have to use low potency, and with high, like a thick leathery skin, you have to have high potency. From low potency, we have 3 agents. Hydrocortisone acetate, that's one of them. Aclometazone and dio. I don't even know. I don't know how to pronounce those things. Anyway, the low potency hydrocortisone, at least I remember that, sedate. Medium potency, most of them finishing with alone, OLONAE. For example, chlorcortalone, fluocinolone. So that's a medium potency. High potency is a fluocitanide for NIDE, and you can remember it by that the end is not in O but IDE, and I is high. That's how I remember. So ultra high potency examples would be diproline, tempovate, ultravate. I guess yeah. Here you go. Can have systemic side effects, so you need to make sure that you monitor that and be aware. Cushing's appearance, adrenal suppression, scaly eruptions. We are moving on to psoriasis. Psoriasis. Can't even. Psoriasis, again, another dry. You have to keep moist. Eczema and psoriasis, you have to keep moist. So we are. It is associated with psoriatic arthritis. If eczema was associated with allergic triad, allergic rhinitis, asthma, and eczema, the psoriasis associated with psoriatic arthritis, as well as IBS, DM, metabolic syndrome, and CAD. So it can be different types. Inverse is a skin folds and where lots of moisture. Inverse, the postural, obviously with pustules. Erythrodermic, when you have entire surface. So entire starts with E, erythrodermic. And guttate, that's a dewdrop appearance. And the nail disease, it's inflammation of nail beds. So just remember, inverse with skin folds, pustulal, erythrodermic, guttate, and nail disease. Not much to remember, but can be confusing when you have too much information. Initial, you have to give topical or systemic, mild to moderate, topical corticosteroids or emollients. And if you have a moderate to severe, you need to not only start with retinoids and methotrexate and cyclosporins and others, you have to refer. Next, we're going to go to acne. Acne may take up to 8 weeks to see results. Topical exfoliants, example, sulfur, retinoids, salicylic acid. As an adverse reaction would be dry skin and irritation. So you might see results like you can see first worsening before you see the better. So retinoids include retinoin, adipalene, tazarotene. So adverse reaction, it can be teratogenic. So avoid with pregnancy. Dry skin, irritation, of course. Don't use with other treatment if it's like those treatments, the dry skin, you have to apply after wash at the bedtime. Topical exfoliants. Next is topical antibiotics agents. Benzyl peroxide, to remember about this, is it's bleaching clothes, so you need to make sure you know that. Side effects, and as well as irritation and contact dermatitis. And topical antibiotic agents such as benzyl peroxide can be gels, lotions, or washes. Another one is erythromycin and clindamycin. I'm thinking about clindamycin is like you clean it, clean your acne. Erythromycin, I'm thinking about, your acne, you kind of red all over, so that's how you do. So topical antibiotics with salicylic acid. So with exfoliants. So Clarisil, Ciosil, benzacline, especially benzacline helps with resistance. So unpredictable penetration, that's a combo. Next is going to be oral antibiotics. You have to give it for 6 months. Whew. Minocycline and doxycycline. So cycle. Tricycline, you remember, that's not for pregnant and not for kids under 8 years old. And tetracyclines also not with cations, positive cations. So you just separate 1 hour from meds. Side effects, resistance, GI, candida, and photosensitivity. So with oral antibiotics, Mino and doxycycline. No pregnant, no kids. Candida, photosensitivity, and not with cations, separate from foods. That will be probably many times asked. Hormonal treatments would be from 3 to 6 months. You have to make sure that they are not pregnant, because it's not only giving for acne but also for birth control. So no pregnant or possible. And it's decreasing estrogen. Other treatment would be Um, oh, and that hormonal you have to. No, 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 not that hormonal. Isotretinoin, which is another treatment, isotretinoin. This is for severe cystic acne. This medication needs to be registered to be prescribed. You have to take with food for 15-20 weeks. Side effects: dry skin, emotional changes, hyperlipidemia, GI and visual changes. Absolutely not for pregnant. It's an X, and test prior and make sure that they control their births. And then monitor LFTs and lipids. Avoid touching it with your own bare hands. We are moving on to Tinea, which is infection by fungus. You have to keep dry and clean. So Tinea capitis, for me, cap is like I'm putting on my head. So that's a scalp, ringworm of scalp. You have to use a greasy or fulvin plus shampoo. This greasy or fulvin you have to take with fat meal, and treatment is from 2 to 4 months. Tinea carposis, ringworm of skin. My body is like corpse, so that's how I remember. So preference is miconazole, clotrimazole, and tonaflotate. So most of them finish with zole. Okay, 3 to 4 weeks. Tinea crutis, ringworm of groin or jock itch. So crutis, kind of like crutch. That's how I remember. So same treatment, minoclonazole and clotrimazole. Tinea pedis. Pedis, everyone kind of remember that's athlete's foot. You have the same treatment with miconazole and clotrimazole. Tinea inguinum, that's the last one, and this is nail. This is the only one that that has letter N inside. So nail, that's how I remember. Systemic antifungal meds is tetrabenafine and itraconazole. That will be with increased rate of cure. And of course, the downside is 12 weeks. 12 weeks. You have to watch for liver, and that will be the first line of treatment. The last and kind of separate tinea is versicolor. It is not fungus, it's a yeast infection. It is topical. So you use shampoo and also topical antifungal that finish with azole, miconazole, like we said before, and clotrimazole. All right, we are all done with the skin.